President Trump and members of his administration said there's been major progress when it comes to finding the root causes of autism, and they're pointing the finger at Tylenol. Let's go to Emma Withrow from the fact check team. So Tylenol's maker is refuting this. Emma, what research did the White House use to come to this conclusion?
So backing up just a little bit first, so the new health guidance recommends that women who are pregnant should not be taking acetaminophen, which is the active pain-relieving ingredient in Tylenol. So the White House cited a number of research studies from the Nurses' Health Study, the Boston Birth Cohort, and also Johns Hopkins. But then at the same time, the FDA released a statement that said, quote, a casual relationship has not been established between Tylenol and autism. So a lot of mixed opinions here.
So break down some of the findings of those studies and how they were able to come to that conclusion.
Yeah, so I dug into the Johns Hopkins study, and they looked at the umbilical cord blood from around 1,000 babies and found that the ones with the highest levels of acetaminophen were about 3 times more likely later to be diagnosed with autism or ADHD compared to the ones with the lowest levels. So the researchers say that there's this shows a strong association, but they also at the same time stress that it doesn't prove Tylenol causes these conditions and that they need to do a little bit more research. Another study, though, published in JAMA looked at 2.5 million Swedish children, and it also contradicted these earlier findings. So like I said earlier, a lot of mixed opinions on this, and we're going to have to wait and see what continues to come out.
All right, Emma, thank you.
Thanks.
A little later on, Emma will be back to dig into additional research on acetaminophen and research on the rates of autism in children. The White House issued a new health warning on Tylenol use for pregnant women. This comes as autism rates nationwide are skyrocketing, with nearly 1 in 31 kids diagnosed. Let's go to Emma Withrow from the fact check team. Did you find any studies that discussed a link between acetaminophen and autism? Because worldwide, some health experts have been refuting that connection.
They definitely have. I dug into one of the studies that the White House referenced in their press release, and the study that I dug into said that the connection has to do with oxidative stress and hormone disruptions. So what does all that mean? Well, scientists think Tylenol might affect a baby's brain because it crosses the placenta and gets to the baby really fast. So once it's there, it can create toxic byproducts that stress developing brain cells, disrupt hormones needed for growth, and also interfere with key brain signaling systems. So this all coincides into that possible connection.
And others in the medical community, they have come out and disagreed with the White House guidance. Is that what most are saying? I know that you reviewed a wide range of data.
Yeah, it's a mixed bag from what I've read. There's definitely a lot of mixed opinions when it comes to this, and the mainstream medical community still believes that it's safe for pregnant women to take acetaminophen, but there are multiple studies showing associations between taking acetaminophen while pregnant and higher rates of autism or ADHD. But then at the same time, other experts in studies like the one you see on your screen say that those associations don't prove causation and could just be explained by other factors.
All right, interesting. Emma, thank you.
Thanks.
For more on this fact check team topic, including links to their sources, scan the QR code or visit thenationaldesk.com.
President Trump now potentially just hours away from signing a deal to save TikTok. Up next, the new details emerging from the plan as millions of American users anxiously wait.
The Trump administration announced major progress in understanding the root causes of autism with studies that showed a possible increased risk linking the use of Tylenol in women who are pregnant. Joining us now to discuss is Dr. Elizabeth Mumper, Senior Fellow of Pediatric Education with the Independent Medical Alliance. Good morning to you, Dr. Mumper. Great to see you.
Yeah, thank you for having me on.
The Trump administration, said on Monday pregnant women should stop taking acetaminophen, Tylenol, because of this research. What's your thoughts on this? What are the risks?
Well, I became aware of this problem about 2 decades ago. We had some data that showed that acetaminophen was associated with autism, and there are plausible reasons why this might happen. For example, children with autism have problems with certain detoxification pathways, the sulfation pathways, which are known to affect acetaminophen metabolism. Also, women in pregnancy are low on something called glutathione, which is very important for detoxification and as an antioxidant, and Tylenol reduces that also. And then there was also research that certain toxic metabolites of the Tylenol itself could actually affect the fetus in utero. So as a result of that, I have not been recommending acetaminophen since about 2003. The research is mixed. There are over 6,000 studies looking at it. Many say there's an association, some do not. I think it's very important to look at confounding factors and also to really look at what the plausible mechanisms might be. In my practice, my rate of autism was 1 in 297 at a time when the national rate was 1 in 50. So I think that's kind of a proof of concept that limiting Tylenol, which was one of the things that we did, could actually be as helpful. I don't want people to think acetaminophen is the only
Correct.
contributor or cause. Yes.
I was going to ask you about that because even just a cursory look online, there's one thing that many doctors, many scientists can all agree on, and that there is a genetic component, correct, that can make a child more prone to develop autism.
Yes. So, despite the relatively small number of children with autism who have a classic chromosomal defect, there are a lot of genetic changes. We call these SNPs, or single nucleotide polymorphisms. These are small changes that might affect the inflammatory pathways or the immune pathways or the detoxification pathways. And we can now identify this with blood work to see which children might be at higher risk. The other thing that I was so glad to see during the hearings was that the administration talked about listening to the parents, because I've evaluated over 600 children with autism, and about 23% of the parents identified the MMR vaccine as a trigger to their child's regression. That doesn't mean that that's the only trigger. And
Correct.
I just think that we need to take this very seriously. And in the past, parents, when they brought up the issue that vaccines might be involved, were often gaslighted or told by their physicians that they were crazy or just overly anxious. So I think the administration signaled a change in this regard. We got a lot of information from parents back when I was medical director of the Autism Research Institute. They actually helped set our research agenda and gave us insights into therapies.
And there's also correlation and causation, as you know. So there's still a lot of research that still needs to be done. But tell us about, the recent hearings on the topic and the changes announced in the vaccine schedule. What did you think about that?
Sorry, you were frozen for a bit on my screen. Tell me about the recent.
The vaccine schedule. The vaccine,
yeah,
because you were just talking about that, because you still would recommend, obviously, MMR, correct?
Yes, but I always gave it at a later date because of some research that the CDC did, especially that showed that African American children seem to do worse in terms of risk of autism if it was given early. So I gave MMR after 3 years of age. I gave to African American children, I gave it at 2 years of age for Caucasian children. But there seems to be a shift from this one size fits all strategy of just following the schedule no matter what, to actually look at individual risks. And so the recent American Committee for Immunization Practices, is moving away from the recommendation to give hepatitis B at birth, for example, and is suggesting maybe do it after a month, or maybe people are suggesting even later. So they're reconsidering these sort of standard recommendations to take into account parental choice, individual risk factors, and individual benefits to particular patients. And I think that's a move in the right direction.
Doctor, great talking to you this morning. And to learn more about this issue and some resources that can be made available to you, all you have to do is visit imahealth.org.
Exposure is very, very low.
Tonight, new details from local doctors on whether Tylenol could cause autism if mothers take the medication during pregnancy. This comes on the heels of President Trump and his administration claiming the painkiller has a direct correlation to autism during pregnancy. And our Cameron Lyme spoke with doctors and mothers today. And Cam, there are already a plethora of medications expecting mothers can't take. And why is Tylenol the focus here?
Yeah, that's right, Tessa. Doctors tell me while there may be a connection between autism and taking Tylenol while pregnant, mothers shouldn't back away from the medication quite yet.
I don't think the available science suggests that Tylenol does cause autism. I think they're linked, and I think it's important not to confuse those two things.
Continued fallout after President Trump's claims Tylenol could cause autism if taken during pregnancy.
Well, let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism.
Parents reacting to the news, unsure of next steps.
I think people are very confused. I think that the benefit probably outweighs the fact that you shouldn't take it if you have a fever.
According to doctors, there is a small possibility the two are linked, but more studies must be done.
I think the long-term evidence and the long-term observations we have is there's no actual causative link, but we definitely want to make sure that that's true, and we need to figure that out. And we need to figure out how they're associated to begin with.
According to Pruitt, we are seeing more cases of autism now than in the past because of further research done on the subject.
And I think the numbers of the diagnoses have increased because I think we're aware of a lot more, and there's a lot of parameters that are out there that probably weren't around.
According to experts, if you are curious about taking Tylenol during pregnancy, talk to your doctor.
You can bounce those questions off of them, and it's best to discuss those things with your doctor.
Tylenol has released a statement in regards to the president's comments saying, quote, "The fact remains unchanged. Over a decade of rigorous research endorsed by leading medical professionals confirmed there is no credible evidence linking acetaminophen to autism." And ahead tonight, hear from parents who disagree with the president and what their advice is for parents. Working for you, Cameron Limes, News 4.
Your breaking news and weather authority. This is 13 WHAM News at 11.
Tonight, local health officials refuting President Trump's claims regarding acetaminophen and pregnant women.
Don't get distracted with things that people are saying that seem rather convenient or don't seem true or not backed by science.
President Trump saying the use of acetaminophen, the main ingredient in Tylenol during pregnancy, could be linked to a higher risk of autism. Good evening. I'm Karen Edwards.
I'm Matt Malloy. The President and Health Secretary Robert F. Kennedy Jr. recommending that pregnant women limit using that drug. As 13 WHAM Stephen Pappas explains, many health officials say the announcement comes with no scientific backing. Stephen?
Yeah, Matt and Karen, the Ontario County Health Director says what causes autism is not as simple as whether you take a certain medication while pregnant.
Local health experts are pushing back after a controversial announcement by President Trump and Health Secretary RFK Jr. on Monday.
So taking Tylenol is not good. All right, I'll say it. It's not good. You know, the way I look at it, don't take it. Don't take it. There's no downside in not taking it. So ideally, you don't take it at all, but if you can't tough it out, or if there's a problem, you're going to end up doing it.
To think that autism is caused by one thing is really naive, and it's just wrong. Autism is a complex disease.
The president says the FDA will start notifying physicians immediately to stop recommending the drug acetaminophen to pregnant women unless in the case of high fever and would pose a risk to the fetus, linking it to an increased risk of autism.
I think people think that pregnant women are just like popping Tylenol 3 times a day. That would be very rare. I worked in OBGYN for 14 years, and women tried so hard not to take medications during pregnancy. They would agonize over every Tylenol, every Sudafed, or whatever else they needed to take for whatever symptom they were having.
Leading medical groups say there have been dozens of large studies over the decades, none of which found acetaminophen to cause autism. Ontario County Director of Public Health Kate Ott says the press conference and its alleged findings are concerning.
We used to be able to trust the CDC, the ACIP, the FDA, and Health and Human Services. They have been the gold standard for my whole career in public health. We can no longer trust them explicitly.
The Monroe County Department of Public Health also releasing a statement refuting the president's remarks, referencing a 2024 study of nearly 2.5 million people that does not support a causal link between acetaminophen use during pregnancy and autism. Ott says she trusts Tylenol for pregnant women.
If I had a pregnant person in my life, I would have no qualms about them taking it. In some instances, it's more dangerous not to take medication. So an early pregnant person, particularly with a fever, needs to treat that fever.
The Department of Health says it will launch a nationwide public service campaign to inform families and protect public health. It will also initiate the process to change those safety labels on the drug. The company that makes Tylenol saying today that it strongly disagrees with the White House's claims. Matt, back to you.